The testing with Lyme disease and the co-infections is a huge topic for debate. Now, Dr. Paul and I love tests, but we also are not naive enough to think that tests are perfect. And I think that's what so many patients tell me. They go, I just want it to be so clear. And I go, we're going to do some of the best tests available to see if we can gain clarity. I have a regiment of tests, but this has been a journey. I tell people I'm on kind of phase 3 of my Lyme journey. We started this 6 or 7 years ago. And the way we test and the way we treat and help people with it is very different than it was 6 or 7 years ago. When I first started, there was a lab company, which is wonderful, and you can read all about different lab companies, but Lyme testing was incredibly expensive to get anything that was even reasonably had some reliability. I mean, we're talking $1,500 to $2,000 for a Lyme plus a co-infection type test. And that's a lot of money. That's a lot of money to really just answer the question of, is this Lyme or not? I mean, it doesn't answer, is it mold? Doesn't answer, do you have inflammation? Doesn't it? There's a whole bunch of other tests that you can run. That's a pretty expensive mark for people. And so one of our searches for the last 6, 7 years is, okay, how can you get a reasonably accurate lab for a price that makes sense for many patients? Because I got to tell you, when the lab was $2,000, I didn't run it very much. It was a little outside of a lot of patients' price range. So what we have been able to get down, long story short with testing, is I usually run 2 tests for Lyme. Now those 2 tests cost about $250. But we think that those have hit the value, cost-value ratio for so many people if I'm suspicious. So we like that procedure. I also like to test for the 2 most common co-infections in Minnesota. So I will routinely run the 2 most common co-infections with Lyme, and it's all under $500. Now you can run more, and we talk about that with each patient who walks in our office, but we often think that running the most common things in Minnesota, double checking the Lyme through 2 different methods, gives us a very good, cost-effective way to evaluate Lyme in people who are coming in to see us. Always correlating it with the clinical symptoms and clinical, picture for our patient.
Sure.